Do you ever feel like your mind is stuck on a loop of thoughts you can't control? Do you perform certain actions, not because you want to, but because an overwhelming feeling tells you that you have to? If this sounds familiar, you are in the right place. We're about to clear away the myths and offer real science-backed understanding and strategies. Introduction and value proposition. Today we're diving deep into a topic that is profoundly misunderstood: obsessive compulsive disorder, or OCD. This video is for anyone who has ever wondered if their persistent, unwanted thoughts are normal, for anyone who feels trapped in a cycle of repetitive behaviors, and for those who love someone who is struggling. We're going to dismantle the #1 misconception about OCD, that it's just about being neat and tidy, and reveal the complex reality of this condition. In this video, we'll explore what OCD really is and the science of what's happening in the brain. Most importantly, we will walk through 5 powerful, evidence-based techniques you can begin to use to regain control. We will also discuss professional treatment options and how to build sustainable habits for long-term well-being. Understanding obsessive compulsive disorder, the unseen battle. When most people hear OCD, they often picture someone who is meticulously organized or constantly cleaning. While fears of contamination can be a part of OCD, this stereotype barely scratches the surface and often trivializes a serious and debilitating condition. At its core, obsessive compulsive disorder is a mental health condition characterized by 2 key components: obsessions and compulsions. Obsessions are not just worries, they are recurrent, persistent, and unwanted thoughts, images, or urges that are intrusive and cause significant anxiety or distress. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. The goal of the compulsion is to prevent or reduce anxiety or to stop a feared event from happening. However, this relief is only temporary and ultimately reinforces the obsessive thought, creating a vicious cycle. Think of it like an overactive alarm system in your brain. For someone with OCD, the brain's danger signal gets stuck in the on position. The science behind the cycle. What's happening in the brain? Neuroimaging studies give us a window into the OCD brain. Research has identified hyperactivity in a specific brain circuit, often called the corticostriato-thalamocortical loop. The orbitofrontal cortex, OFC, involved in decision-making, becomes overactive, leading to an exaggerated sense of risk or error. The anterior cingulate cortex, ACC, which helps with error detection, also goes into overdrive, contributing to the intense anxiety and feeling that something is not right. These signals are looped through the striatum and thalamus, which are involved in habit formation and relaying sensory information. In essence, the brain gets stuck in a feedback loop of wrongness. It detects an error, the obsession, and tries to fix it, the compulsion, but the all-clear signal that should turn off the alarm never arrives. Neurotransmitters, the brain's chemical messengers, also play a crucial role. Serotonin, which helps regulate mood and impulse control, is thought to be imbalanced in individuals with OCD. This is why medications that increase serotonin levels can be effective. Beyond the stereotypes, the many faces of OCD is incredibly diverse. The content of obsessions can vary widely, leading to different subtypes. Harm OCD. This involves intrusive thoughts of harming oneself or others, despite having no desire to do so. A compulsion might be hiding all sharp objects or mentally reviewing past actions to prove they are not a violent person. Relationship OCD. This centers on persistent doubts about one's relationship. Sufferers may constantly question their love for their partner or whether the relationship is right. Compulsions can include constantly seeking reassurance. Scrupulosity, religious or moral OCD. This involves an obsession with religious or moral correctness. An individual might have intrusive, blasphemous thoughts and feel compelled to pray excessively. Existential OCD. This involves getting stuck on deep, unanswerable questions about the nature of reality or the purpose of life. Compulsions may involve endless mental rumination. Somatic OCD, sensoromotor obsessions. This is a hyper-awareness of bodily processes like blinking, breathing, or swallowing. The fear is that they will never be able to stop thinking about it, leading to compulsions of trying to perform these automatic functions perfectly. You are not alone. Impactful statistics. The World Health Organization estimates that OCD affects approximately 1% of the population globally. In the United States, about 1 in 40 adults will experience OCD at some point in their lives. That's over 3 million people. The average age of onset is around 19 years old, with about 25% of cases starting by age 14. OCD affects people of all genders, backgrounds, and cultures. These statistics are not just numbers. They are a reminder that there is a vast community of people who understand what you're going through. Actionable solutions and strategies. Understanding OCD is the first step, but taking action is where healing begins. Here are 5 powerful science-backed techniques to help you manage OCD symptoms. Technique 1. Exposure and Response Prevention, ERP, the gold standard. What it is. Exposure and Response Prevention, ERP, is a specific type of cognitive behavioral therapy, CBT, and is considered the most effective treatment for OCD. It involves 2 parts. Exposure, where you voluntarily confront the thoughts, images, objects, and situations that trigger your obsessions, and response prevention, where you make the choice to not engage in the compulsive behavior. The scientific principle, ERP, works on the principle of habituation. When you stay in an anxiety-provoking situation without performing a compulsion, your brain gradually learns that the feared outcome doesn't happen and that the anxiety itself is tolerable and will eventually decrease on its own. You are essentially retraining your brain to not see the trigger as a threat. How to do it, a step-by-step guide. It is highly recommended to do ERP with a trained therapist, but understanding the steps is empowering. Create a fear hierarchy. Make a list of your triggers, from the least anxiety-provoking to the most terrifying. Rate each one on a scale from 0 to 100 in terms of the distress it causes. Start small. Begin with an exposure that is low on your hierarchy, something that causes mild anxiety but feels manageable. For someone with contamination fears, this might be touching a doorknob in their own house and not washing their hands immediately. Initiate the exposure. Deliberately engage with the trigger. The goal is to bring on the obsessive thought and the associated anxiety. Practice response prevention. This is the crucial part. Resist the urge to perform the compulsion. The anxiety will likely spike. This is normal and expected. Your job is to sit with that discomfort without fixing it. Ride the wave. Stay with the anxiety until it naturally begins to subside. This can take time, but it will happen. You are teaching your brain that you can handle the distress. Repeat. Consistency is key. Repeat this exposure exercise regularly until the anxiety associated with it significantly decreases. Once you feel confident, you can move up to the next item on your fear hierarchy. Why it works. ERP directly breaks the OCD cycle. By preventing the compulsive response, you stop reinforcing the connection between the obsession and the temporary relief. This weakens the obsession's power and builds your tolerance for uncertainty and discomfort. Tips for beginners. Be patient and compassionate. This is hard work. Acknowledge your effort and courage. Don't aim for zero anxiety. The goal is not to eliminate anxiety, but to learn to manage it without compulsions. Start with imaginal exposure. If a real-life exposure feels too overwhelming, you can start by vividly imagining yourself in the feared situation. Technique 2. Acceptance and commitment. Therapy, ACT, changing your relationship with thoughts. What it is, acceptance and commitment. Therapy, ACT, is a mindfulness-based therapy that, instead of trying to eliminate distressing thoughts, teaches you to accept their presence and not let them dictate your actions. The scientific principle. ACT operates on the idea that suffering doesn't come from the thoughts themselves, but from our struggle against them. By practicing acceptance and cognitive diffusion, separating from your thoughts, you reduce the thought's power and create space to choose behaviors that align with your personal values. How to do it, a step-by-step guide. Identify your values. What truly matters to you in life? Is it family, creativity, learning, compassion? Write down your core values. This becomes your compass. Practice cognitive diffusion. Learn to see your thoughts as just thoughts, words and images passing through your mind, not as objective truths or commands. I'm having the thought that, instead of my hands are contaminated, say to yourself, I'm having the thought that my hands are contaminated. This creates distance. Thank your mind. When an obsessive thought appears, say, thanks mind for that thought. This acknowledges it without getting entangled. Silly voice technique. Repeat the obsessive thought in a cartoon character's voice. This strips the thought of its seriousness. Practice acceptance. Acceptance in ACT doesn't mean liking the anxiety. It means allowing the feeling to be there without fighting it. Breathe into the physical sensation and observe it with curiosity. Commit to action. With your values as your guide, take small actions that move you toward the life you want, even if obsessive thoughts and anxiety are present. Why it works. A CT helps you step out of the futile war with your own mind. It reduces the secondary struggle, the anxiety about your anxiety, and frees up mental energy to focus on what gives your life meaning. Technique 3. Mindfulness and grounding exercises. Anchoring in the present. What it is. Mindfulness is the practice of paying attention to the present moment on purpose, without judgment. Grounding exercises are specific mindfulness techniques designed to pull your attention away from distressing thoughts and anchor you in the here and now. The scientific principle. OCD traps you in future-oriented fears. What if? No? Mindfulness and grounding break this cycle by redirecting your brain's focus to the concrete reality of the present moment. This calms the nervous system. How to do it, step-by-step guides. The 5-4-3-2-1 grounding technique. When you feel a thought spiral beginning, pause and gently guide your attention to 5 things you can see. Notice small details, the texture of a wall, a color, the light. 4 things you can feel. The sensation of your feet on the floor, the texture of your clothing. 3 things you can hear, the hum of a computer, birds outside, your own breathing. 2 things you can smell, the scent of coffee or simply the air in the room. 1 thing you can taste, take a sip of water or notice the taste of your own mouth. Mindful breathing, sit comfortably, bring your full attention to the sensation of your breath. Notice the feeling of the air entering your nostrils, filling your lungs, and the gentle rise and fall of your belly. Your mind will wander. When you notice it has wandered, gently guide your attention back to your breath. Start with just 2 to 3 minutes a day. Why it works. These practices train your attention muscle. The more you practice redirecting your focus, the less you will be at the mercy of intrusive thoughts. You learn that you are the observer of your thoughts, not the thoughts themselves. Technique 4. Scheduled worry time. Containing the obsessions. What it is. This is a cognitive technique where you set aside a specific, limited period of time each day to intentionally focus on your obsessive worries. Outside of this scheduled time, you practice postponing the worry. The scientific principle. By creating a designated container for obsessive thoughts, you prevent them from spilling over into your entire day. It teaches you that you have a degree of control over when you engage with these thoughts. How to do it. A step-by-step guide. Schedule it. Choose a specific time and duration, for example, 15 minutes at 5 p.m. every day. Do not schedule it too close to bedtime. Postpone the worry. When an obsessive thought arises during the day, acknowledge it and then make a conscious decision to postpone it. You can say to yourself, I will give this my full attention at 5 p.m. Engage fully during worry time. When your scheduled time arrives, sit down and allow yourself to think about and worry about the things you postponed for the full 15 minutes. Stop when time is up. When the timer goes off, stop. Take a deep breath and consciously shift your attention to a different, engaging activity. Why it works. This technique disrupts the urgency that OCD creates. It proves that you don't have to address a worry the second it appears. Often, by the time worry time arrives, the thought has lost much of its emotional charge. Technique 5. Lifestyle integration, building a resilient foundation. What it is. This involves cultivating daily habits that support overall mental and physical well-being, which in turn makes you more resilient to OCD symptoms. The scientific principle: the brain and body are deeply connected. Chronic stress, poor sleep, and a nutrient-poor diet can exacerbate anxiety and make OCD symptoms harder to manage. How to do it. Key habits to cultivate. Prioritize sleep. Aim for a consistent sleep schedule. Lack of sleep can significantly increase anxiety and intrusive thoughts. Engage in regular exercise. Aerobic exercise like brisk walking or jogging is a powerful anxiety reducer. It helps regulate stress hormones and boosts mood-enhancing neurotransmitters. Eat a balanced diet. Stable blood sugar is key to a stable mood. Focus on whole foods, lean proteins, healthy fats, and complex carbohydrates. Connect with others. Isolation can make OCD worse. Make time for supportive friends and family. Sharing your experience with trusted individuals can reduce feelings of shame. Why it works. These habits lower your overall baseline of stress and anxiety. A well-rested, well-nourished, and physically active brain is better equipped to engage in the hard work of therapy, like ERP. Bonus section: complementary strategies to support your journey. While evidence-based therapies like ERP are the primary treatments for OCD, integrating certain complementary strategies can provide additional support and improve your overall quality of life. 1. Nutritional psychiatry. The gut-brain connection. The connection between what you eat and how you feel is profound. While no diet can cure OCD, certain nutritional strategies can help manage anxiety and support brain health. Understanding the gut-brain axis. Your gut and brain are in constant communication. A significant portion of your body's serotonin is produced in the gut. An unhealthy gut environment caused by a diet high in processed foods can lead to inflammation, which has been linked to increased anxiety. Focus on anti-inflammatory foods. Incorporate foods that fight inflammation. This includes omega-3 fatty acids, found in fatty fish, flax seeds, and walnuts. Antioxidant-rich fruits and vegetables. Berries and leafy greens protect the brain from stress. Prioritize complex carbohydrates. Oatmeal, quinoa, and sweet potatoes provide a steady supply of glucose, the brain's primary fuel, preventing blood sugar crashes that can worsen anxiety. Key nutrients for brain health. Magnesium, often called the calming mineral, it is found in almonds, avocados, and dark chocolate. B vitamins, essential for the production of neurotransmitters, found in lean meats and eggs. A practical tip: start by adding one brain-healthy food to your daily routine, like a handful of walnuts for a snack. 2. The power of flow states, engaging in creative outlets. A flow state is being fully immersed and energized in an activity where time seems to disappear. For someone with OCD, engaging in activities that induce flow can be a powerful respite from intrusive thoughts. Why it works. When you're in a state of flow, your brain's prefrontal cortex, the part responsible for self-critical thoughts, temporarily becomes less active. You are fully engaged in the present, leaving little mental bandwidth for obsessions. Finding your flow. This is highly personal. It could be painting, playing a musical instrument, gardening, or coding. The key is that the activity should be challenging but achievable and intrinsically rewarding. How to start. Explore something new you've been curious about. Dedicate even 20 to 30 minutes a few times a week to this activity. 3. Therapeutic journaling, externalizing the internal battle. Journaling can be a structured way to process the experience of OCD, externalize thoughts, and track your therapeutic progress. ERP progress log. Dedicate a section of your journal to your ERP work. For each exercise, write down the exposure, your anxiety level before, during, and after, and the compulsions you resisted. This provides concrete evidence of your progress. Cognitive diffusion. Prompts. Use your journal to practice separating from your thoughts. Write down an obsessive thought and then reframe it using prompts like, "My mind is generating the thought that." Values-based writing. Write about your core values and how OCD gets in the way of living them. Then brainstorm one small, concrete action you can take to live by one of those values, despite the presence of OCD. Do's and don'ts for managing OCD. Do. Acknowledge that the thoughts are a symptom of OCD, not a reflection of your character. Don't. Argue with or try to reason with an obsessive thought. This gives it more power. Do. Practice self-compassion. Managing OCD is challenging. Be kind to yourself. Don't. Seek reassurance from others as a compulsion. This strengthens the OCD cycle. Do. Celebrate small victories. Every time you resist a compulsion, you are rewiring your brain. Don't. Avoid situations that trigger you. Avoidance makes your world smaller. Do. Focus on progress, not perfection. Recovery is not a straight line. Information on professional treatment and medication. While self-help strategies are powerful, professional guidance is often essential for recovery. Therapeutic approaches. Cognitive behavioral therapy, CBT. This is the umbrella category for therapies that focus on changing unhealthy thought and behavior patterns. Exposure and response prevention, ERP, is the most effective form of CBT for OCD. Acceptance and commitment therapy, ACT. As detailed earlier, ACT is increasingly used alongside ERP to help with motivation and to handle the difficult emotions that arise during treatment. It is crucial to find a therapist who is specifically trained in treating OCD, particularly with ERP. Medication for informational purposes. For some individuals, medication can be a very helpful tool, often used in combination with therapy. Selective serotonin reuptake inhibitors, SSRIs. These are typically the first-line medications prescribed for OCD. They work by increasing the levels of serotonin in the brain. Clomipramine, anafranil. This is a tricyclic antidepressant that is also very effective for OCD, though it sometimes has more side effects than SSR is. Augmentation strategies. If a first-line medication isn't fully effective, a doctor might recommend adding another type of medication to boost the effects. This information is purely educational. Only a qualified medical doctor or psychiatrist can diagnose and prescribe medication. Never start, stop, or change a medication without medical supervision. Precautions and potential dangers of unaddressed OCD. Leaving OCD unaddressed can have significant and compounding consequences. Worsening symptoms. OCD is often a chronic condition that can worsen over time if not treated. The cycle of obsessions and compulsions can become more entrenched. Impact on daily functioning. As OCD grows, it can severely impair your ability to work, succeed in school, and maintain relationships. Strained relationships and social isolation. The demands of OCD rituals and the need for reassurance can put immense strain on relationships, leading to isolation. Development of co-occurring conditions. It is common for untreated OCD to lead to other challenges like depression, other anxiety disorders, or substance use issues. Diminished quality of life. The constant anxiety and stress can rob you of joy, spontaneity, and peace of mind. Taking the step to seek treatment is a preventative measure against these long-term impacts. How to make it a sustainable habit. Integrating these techniques into your life is a journey. Here's how to make these strategies a sustainable part of your life. Start small. Don't try to tackle your biggest fear on day one. Choose one small, manageable practice, like a 2-minute mindful breathing exercise. Anchor to existing routines. Link a new practice to something you already do. For example, practice the 5-4-3-2-1 grounding technique every time you wash your hands. Track your progress. Keep a simple journal. Note which exposures you attempted or one small value-driven action you took. Seeing your progress on paper can be incredibly motivating. Find social support. Share your goals with a trusted friend, family member, or a support group. Connection combats the isolation that OCD thrives on. Practice progress, not perfection. There will be days when you fall back into old patterns. This is not a failure. It is part of the process. Treat each lapse as a learning opportunity and gently guide yourself back to your strategies. Conclusion. We've covered a lot of ground today, and the most important takeaway is this. Obsessive compulsive disorder is a real neurobiological condition, not a personality quirk or a character flaw. It's far more than just cleaning. It's a challenging internal battle against a brain that is sending false alarms. But you are not powerless. Healing and recovery are absolutely possible. Through powerful, evidence-based tools like exposure and response prevention, acceptance and commitment therapy, and mindfulness, you can learn to break the cycle. You can change your relationship with your thoughts and reclaim your life from compulsions. Taking these small, consistent steps is the key to lasting change. You have the strength to do this, and you deserve to live a life free from the grip of OCD. Disclaimer: this video is for educational and informational purposes only. The information we're sharing is designed to support, not replace, the relationship that exists between you and your healthcare provider.